Today, we'll be having another very interesting talk that will be delivered by Professor Ganiyu Oboh. Professor Ganiyu Oboh is from the Department of Biochemistry, Federal University of Technology, Akure, in Ondo State, Nigeria. The topic of his discourse is translating functional foods and medicinal plant research to sustainable healthcare delivery. Professor Ganiyu Oboh is a Nigerian professor of applied biochemistry at the Federal University of Technology, Akure, popularly known as FUTA. He is currently the head of the Functional Food and Nutraceutical Laboratory Unit in the department, and we have seen that he has recommended cure to diabetes. In fact, in 2021, he was awarded the best researcher according to our Doja Scientific Index. Professor Ganiyu Oboh obtained his first degree in the Department of Biochemistry at FUTA. In 1992, he earned his master's degree in technology and PhD degree in applied biochemistry in 1997 and 2002, respectively, from the same institution. He had two very good postdoctoral training in biochemistry and toxicology in 2015 in Brazil, and another one in food biochemistry and toxicology between 2007 and 2008 at the Technische Universität Dresden, Germany. Professor Oboh joined the Department of Biochemistry in FUTA, where he rose through the rank to become a professor of applied biochemistry. His research areas include nutritional biochemistry, plant biochemistry, and food chemistry. In fact, in 2017, he delivered a lecture on functional foods, paradigm for health and wellness, where he highlighted the connections between poor diet and diseases like diabetes, stroke, cancer, and heart diseases. He advocates increased consumption of fruits and vegetables to mitigate the risks from these diseases. His scientific research also explores the antioxidant activities of indigenous plant materials, several of them. As of today, in 2026, his research output on Scopus includes over 300 plus scholarly publications with over 24,000 citations on Google Scholar and H-index of 80. He has trained many undergraduate students, master students, PhD students, and he has even given birth to a lot of professors who has added and contributed to knowledge and to society development in Nigeria and beyond.
Thank you very much for giving me this opportunity to come and deliver this lecture. I must appreciate the organizers, and I hope at the end of the day, I will be able to share some of my research work over the years with you. This evening, I will be speaking on translating functional foods and medicinal plants to sustainable healthcare delivery. You see, more than ever before, we have a number of research going on in our laboratories, but the impact is not being seen. There's this big gulf between research activity and the impact. So that's why, the main message I want to pass across is that we should just go beyond lab analysis. We should look for a way in which we move our research work to the major beneficiary. So when it comes today, a lot of things is happening in the scientific world. You talk of medicine, agriculture, renewable energy, technology. A lot is actually happening. But a place, especially in Africa, most of our research findings remains on the shelf. And so that is why I will spend some few minutes addressing research edition in our institution. As of today, most of our research receives several publications, 500, 300, without any commercial product. As a matter of fact, most of the research we do in Africa does not get to commercial state. And our research is just for publication. That is, we want to get our next promotion to readership, to professor, to SL. That has been the focus of our research over the years. So in essence, the way we do our research has less impact. And that is why we are talking of translating functional food and medicinal plant research to sustainable health care. And the first thing we need to know, yes, medicinal plant is well known to people. Yes, but what is functional food, which is the main thing I want to speak on now? You know, several years back, Hippocrates came out with this slogan, "Let food be thy medicine, and medicine be thy food." But our argument in recent time is that not all food can be your medicine. There are some food that will even cause more damage to you. So we have modified that term to be, "Let functional foods be thy medicine." So not all food that can be your medicine, but the food that can be your medicine, they should be functional food. And the question that comes up is that, what is functional food? In fact, you have various definitions for functional food, but for the purpose of this talk, I will limit myself to this definition. That as any food or food ingredients that may provide health benefit beyond the traditional nutrient it contains. So if any food can provide additional health benefit apart from the usual nutrient, talk of protein, carbohydrate, fat and oil, mineral, all those stuff, any food that can provide additional health benefit is referred to as functional food. And before a food can be qualified as functional food, there are some conditions. The first thing is that it's not a capsule, it's not a tablet, neither is it a powder. Rather, it's a food that you derive from naturally occurring ingredients. So it should be a part of our daily feeding. Then, this food should be consumed as part of our daily diet. And particularly, that food should be able to regulate a particular body process. Number one, that food should be able to improve the body biological defense mechanism. That is, the food could be an immune booster. It could assist your immune system. It could help you to fight disease. Then number two, the food should be able to prevent or enhance recovery from a specific disease. And the food should be able to control mental health and physical condition. And finally, the food should be able to slow down the process of aging. Any food that has those qualities, the food that can fight disease, the food that can help you to recover from disease, the food that can improve your mental or physical condition or retard aging, that food is functional food. So go online, a number of work has been going on. You see a number of publications, antioxidant, anti-aging, anti-cancer, anti-radical, antifungal, a lot of things, anti-diarrhea, anti-diabetic, anti-hypertensive, hepatoprotective, nephroprotective, a number of them. But what we are saying here is that we need to move those things beyond the level of publication. Let the woman in the hospital, let the man in the hospital benefit for it. That's the message we are trying to pass across when it comes to functional food. And when it comes to translational research. Then when it comes to functional food, you have various categories of functional food. The first category, which is one of the most common one, is your probiotics. Our colleagues in microbiology, they are very good in those areas. Where somebody will consume live organism in the form of things like yogurt, and those things have some beneficial microbes that help in the system. Then, apart from the probiotic, you talk of the conventional food, and you have a number of them, and I know over the years we have worked on several conventional foods, things like Bambara granite, things like Kaganos Kaja, pigeon pea. In fact, we have a number of them that has been shown to have medicinal value. Even this one we have there, the black seed, Nigella sativa. You have several of them that are conventional food. But in recent time, what we work on in our laboratory is designers food, where food are specifically designed to address one disease or the other. So based on their information on their bioactive compound, their phenolic compound, their alkaloid, all those compounds that are there, we can incorporate those extra, the nutraceuticals, and deliberately use it to design food to fight cancer, to fight heart disease like hypertension, all those ones, to fight diabetes and all the other things. So in that case, consciously, there's a way you formulate that food, there's a way you package that food to design to address a particular disease or the other. Then the next thing we need to stick on, and I said it earlier, there are a number, all those things I said earlier, go online, Google, a number of articles are there, a number of plants are there, a number of food are there. But the problem is that why is it that this research finding is not getting to our hospital, it's not getting to the friend that is sick? So that's why we are talking of translational research. The question now comes, what is translational research? It does have to do with translating knowledge gained from the laboratory science to clinical practice to improve health. That is just the idea. There's a knowledge, there's a finding. Now, translating those knowledge to clinical practice. That's what we are. So when you are doing that, you are talking of translational research. In essence, the focus is the integration of activities from the bench, your laboratory bench, your animal experiment, your in vitro analysis, all those, your MIC, minimum, all those things now, translating it to the bedside, somebody in the hospital bed, translating the knowledge acquired. When you are doing that, you are talking of translational research. And this scheme shows what we mean. You see, you are from the bench to bedside, then to the entire community. So when you are doing this one, you are doing translational research. The aim of translational research is to come out with therapeutics. be it drug, be it supplement, be it food, things that all those things, all the antiviral, antibacterial, anti, translate it to therapeutics. Not staying at the level of paper, but moving into a particular product. That's where technology comes in. I tell people, it's easy to just come to the lab and do your in vitro study, your animal experiment. But to move it to a deliverable is another job. Sometimes people spend 1-2 years. You can develop it, but the drug will not be delivered. So it's a real job. So you can come up with therapeutics. You can come up with medical devices, tools for diagnosing diseases, and you create an avenue for community engagement research. When you are doing that, that is sort of the major aim of translational research. Then what are the objectives of translational research? Number one is to accelerate the moving of findings from bench research to bedside. That is the first major thing. The major objective, the main objective is to move all those your findings. I'm sure many of us have a number of findings, a number of discovery. Let's now take a step further to move it to the hospital, to move it to bedside. Another objective is to enhance collaboration between researchers in different fields of translational research. Obviously, in most cases, translational research cannot be done by an individual. You need various stakeholders. So in most cases, translational research is multidisciplinary. Then you can utilize personnel from different disciplines to focus on common goal. And finally, to promote optimal outcomes for all patients. So when we are doing that, we are doing translation. Those are the main objectives of translational research. Stages of translational research. As a matter of fact, in most of our laboratories, we are only involved in the basic research, more of in vitro analysis, and we go on to publish. So I have 5 stages there. You have the basic research, which generally carried out in the laboratory. We have the preclinical research, where we test those things in animal or human tissue or animated model. And from observation, the bulk of our research in Nigeria and other African countries by extension doesn't go beyond preclinical research. Then, after the preclinical research, we have been able to establish the appropriate dose, establish many things. We cannot go to the clinical research, and this one requires a lot of getting approval from various regulatory bodies. Then, after that one, we now go on to clinical implementation. This one involves exploring strategies that will assist in the adoption of intervention and innovations. And finally is the public health. We want to see the impact of this intervention at the population level. So those are the various stages, and I can assure you that's a big challenge in Nigeria as of today. I don't know the number of laboratory that can do a complete implementation. And unfortunately, that is the way to go. That's the way to go. So I think we really need to improve on our health facilities in Nigeria and Africa in general. Obviously, there are a number of advantages of translational research, as I have it there. So you have a number of them. But time will not permit me to start going through them one after the other. But since I'm going to drop the slide, you can see them. It has a number of advantages, Then, having done that, let me just take you to some of the work I've been doing in my lab. We have been trying to do some translational research, especially in my field of study, functional food and plasticas. From that slide, yes, we have tried to develop various medicinal beverages, medicinal biscuits, pasta, essential oil, anti-diabetic bread, anti-hypertensive bread. We have produced several of them. So the first slide I will be showing you is our functional noodles. These noodles, we produce it from plantain, and it's of low glycemic index, and it has anti-diabetic property. It has antioxidant properties with good sensory quality, and it enhances sensory antioxidants. And we observe that the noodles is a good inhibitor of alpha-amylase, alpha-glucosidase, which is the therapeutic target for this drug, Akure. So, Akure is some of those drugs we use in the management of diabetes. And its therapeutic target is to inhibit these two enzymes, thereby slowing down the release of glucose into the blood. We discovered that these noodles could inhibit those enzymes and enhance serum antioxidant, and thereby that one provided an explanation for its anti-diabetic properties. Apart from that, that's a product from our lab, and we have the patent already. Then this one is functional ice cream. It has low glycemic index, it has anti-diabetic property, it reduces weight, it reverses elevated brain cholinergic enzyme, so it interferes with the cholinergic system. It has hypocholesterolemia property, and it has antioxidant property, and as well as anti-diabetic. So this is another ice cream that we have produced based on the knowledge we acquire from some of our plants. We are able to develop this ice cream for diabetic patients. Then this other one, yes, this is for their breakfast cereal, because we know most of our diabetic patients, they have a problem of choice of food. That's why we were able to develop these cornflakes for them. The cornflakes has low glycemic index and it has anti-diabetic properties. Then there's this other product we have, what we call anti-malaria shortbread. So we also developed this shortbread. We already have the patent. It's an immune booster. It reduces the plasmodium load and all the symptoms associated with malaria. And it has antioxidant property, and at the same time it enhances serum antioxidant. The product already, we have a patent for that. Yeah, this one is organoselenium fertilizer. We have to develop this fertilizer based on the fact that recent findings have shown that there's a correlation between soil selenium and spread of viral infection. So, and from one of the work we did, we discovered that the selenium level in Nigeria's soil is very low. So, we have to come up with a fertilizer that you can use to grow your crop and to boost the selenium level. And thereafter, some of those crops, precisely vegetable, we grew using this fertilizer, though we have a patent for that fertilizer. We use it to produce cookies, what we call green cookies. And I can tell you, we tested the green cookies on HIV patients, haven't gotten the various ethical approval we needed. We observed that the thing lowers viral load. So in HIV patients, we also observed that the cookies has anti-inflammatory property, has antioxidant property, and is an immune booster. So that is what we observed. So we call it group cookies. We already have a patent for these cookies. We already have a patent for these cookies. Then we have this polyherba tea. It's an anti-stress, and it lowers blood pressure. It's also anti-diabetic, so it can be used to control diabetes, hypertension, comorbidity. It has hypochloremic property as well as antioxidant property. Then we have this one, bitterly flavored alcohol-free wheat beer. We have a patent for this beer. This beer can lower blood glucose, so it has anti-diabetic property. We also observe that the beer can upregulate insulin gene and glutathione gene. And we also have a variant of this beer. I'm not sure it's in this PowerPoint. The one we called berry flavored alcohol-free beer. Berry flavored alcohol-free beer. In fact, the article just came out. That one also lowers hypertension and diabetes. Another thing we observe is that the beer also have anti-malaria properties. This one of our product again, this one, we produce this from moringa. This one is supposed to be used for the management of foot or treatment of foot ulcer, diabetic foot ulcer. Diabetic foot ulcer. Then the next slide is our ogiri cube. We came out with this special thing. Same time, we have a root cube. We have a root cube. And we have this one for women that has menstrual cramp, a special ginger tea. And this other one, it was in the market for so long before the fellow traveled out. Our special bread, ginger and turmeric bread. So we hope to bring it back to market. We have to bring it back to market. Then this other product, there's this one there. This one, though I have several products there, but I have interest in this last one. If you can see it with my cursor, that one is meant for skin disease, especially for children. It can be used for treatment of the skin. Especially, I don't know the name in English. I know they call it alefo in Yoruba, and the thing was like magic. Just rub the cream, it will go. They haven't said that. What we have, what are the challenges we are facing in translational research in Nigeria? We have the environmental and non-human resources factor. Number one is the problem of inadequate funding. It's a serious issue. Just like the way it affects other lines of research, it also affects translational research. I must tell you the truth. Translational research is capital intensive. To do a good one, you need a lot of money. So adequate funding is one of the major factors affecting translational research. Another problem we have is the issue of embezzlement and other corrupt practice, either from the area of the researcher or the administrator of the fund or the institution administering the fund, charging you various things, VAT. You have also, they have various ways of taking back some of the money. So there's this corruption both in the side of the researcher and the various organs that are involved in the administration of funds, which I think is also a very serious issue. Then another serious one is the issue of equipment. With the present exchange rate is killing. The one you have even acquired, how do you maintain it? Another problem is the institutional policy. It's a serious issue and some government policy that doesn't favor this doing those research. I think it's a major problem, which I feel when we get to our discussion and question and answer time, we will to discuss. Then the other aspect is the human factor. That has to do with lack of interest and motivation, which is very loud now. Many people are losing interest in the job, poor pay, not having conducive environment. A number of issues are coming up that make doing good research difficult. And this thing is really affecting actually the upcoming researchers. That's why you have this JAPA syndrome. Get to the university, you have an idea, but no conducive environment to execute it. Then the other thing is inadequate mentoring. It's a serious one where people are not properly mentored or not having a mentor at all. And another problem is the issue of lack of exposure. Lack of exposure could also be a major factor. Let me now come, before I go on to conclusion, what are my recommendations? Number one, there should be improved funding for translational research. I told you, it's capital intensive. Then dedicated research institutions, not just one. If possible, it should be in each of the geopolitical zone in Nigeria. Mentorship, that one cannot be overemphasized. International exposure, then implementing favorable policies and practices. Regular training and retraining of personnel. By way of conclusion, I will just read out this first slide. As more and more research we carry out in our respective laboratories, let's bear it in mind that it is incomplete. Until that information can be translated to a product that would make life better for everyone. That has been the cruise of our work in functional food and nutraceuticals. Dear, these are the members of my team. Thank you.
Thank you very much, Prof. We are really grateful for the wonderful lecture. We are inspired and we are encouraged to do well in our research, to continue to be engaged in transnational research that will contribute to the society, that will uplift our society, that will be powerful and take us beyond the level we are currently in. I can testify that your wealth of experience, has been laid bare, and we have learned a lot from you. Thank you very much, sir.
Okay. The floor is open for comments, questions, and answers. So if you have a question, answers, or comments, please put up your hand, and then we'll be duly acknowledged.
My question is twofold. I want to find out, is translational research only limited to the health sector? Is it limited only to the health sector? Then number two, you mentioned that it is finance intensive, and look at the number of products you have been able to come up with, what we call high impact product. How then are you able to really fund this type of research that has resulted in these large number of high impact products? Thank you very much.
Thank you very much, Professor Zeki. In fact, though the original concept of translational research is more of a sector, though it's now at a broader level. The original concept of translational is bench to bedside research. But today we are not taking it to broaden it to more impact thing. But in reality, the concept of translational research started from the health sector, though it is now being broadened. Then the other issue, yes, I can show you most of those work there, we have one grant or the other to develop them. It's not just using our salary. But virtually all the product there, they were funded from either national grant or international grant. So that is just the truth of the matter. Because product, yes, you can do your in vitro, convert it to a product, then testing the product both in animal and human. Sincerely, it's very expensive. It's very expensive. And for you to do a good translational research, you just have to get grants. That's the truth. It's not type of work you can do with your salary. You need a good grant. That's all I will just say for now.
There's a question in the chat by Dr. Ajaf. She asks that you've mentioned a lot of products, but where are these products available in the market? And this is also one of the questions being asked by another person for Longshore Diaguna. So, Prof.
Okay, like when I was delivering the lecture, I know some time ago we gave out ginger and turmeric bread. They were in market for a while before the producer left the country. So that altered it. So we are trying to bring that one back to the market, and others are not yet in market. They are just produced. Probably during our Farmer Food Congress, we bring them there. But I know ginger and turmeric bread were in market for so long. Though my university, we are working on possibility of producing it ourselves, but for now, they're out of market. And that's another thing, what this Professor Bamiro will call the value of debt, moving those things from laboratory now going to the marketplace, which is the in-talk. Those of us that are in Abuja, in the Nigeria Academy of Science, is research to market. And it's a lot of job moving your product to marketplace. It's a serious one. Though I hope we get there in Nigeria.
My question is, what is the relationship between the researcher and the industries, particularly in the area when you mentioned that the product was formerly in the market and it was halted, maybe due to the producer that is in charge of it. Then we know that there are many industries that are into the production of all those in existing one, now introducing these functional food to them. What has been the efforts that the researchers are making, or what are some of those things that you think is causing the kind of advantage? Thank you, sir.
That's a very good question. Actually, there's a major problem. There's a major problem in the country.
Okay, so
In my own opinion, I don't think it should be the edict of the researcher to move it to market. What I would advocate in our institution, there should be an office, a facilitator, because you cannot be busy in the laboratory and sometimes you are the one looking for somebody to commercialize. I think that is one of the missing gap in many of our institutions, where if I like those one that we commercialize, I have to use my office as director of research then to facilitate it. But what I feel is that the way I feel we should go in our institution, we should create an office that will facilitate the translation of some of our invention to market. The office will facilitate the meeting between the industry and the academics. But a situation where you are the one in the laboratory, you are the one also looking at the industrialist, looking for the industrialist. Most times it doesn't even work. That is one aspect. Then the other aspect is the legal aspect. You see, then this commercialization is not just to go and produce. There should be the legal aspect. Someone that will facilitate the MOU, define the terms, the sharing formula. There are a lot of things that goes in there. And most of those things, even we scientists, we don't even know it. It takes getting experts, getting the legal man, the business people that will broker a deal. Okay, from your interest, that's how we are going to share it. This is time you're supposed to remit. If you didn't remit the thing you're supposed to remit, what happens? Do we withdraw it from? It's not just that one goes beyond sitting there in the laboratory and pipetting. So what I'm trying to say is that aspect is missing in most Nigerian universities. Even the extension officer has a role to play, because some of those things, the public enlightenment. So it's not a thing that you can just sit down in your own laboratory, develop product, and be doing that. That's why I see there are many products hanging around in many universities, which I'm aware of. I've gone out to give talk. People tell that I've discovered this. What is happening to it? No facilitator. Some people ask the patent, several patents. You have it, but you need an office that will facilitate the movement, that will look for the industrialists, that will package the legal document. In fact, but sincerely, I'm not sure there's any university in Nigeria I know of that is doing those things. All we are talking of do research, but there's nobody that is bringing us together. I think our universities need to create such an office where somebody that, okay, you have discovered this thing, bring your industrialists together, work out an MOU, do the inventor. What are you going to get as a royalty? No, so sincerely, it's rather unfortunate. Not something deliberate is done. We'll just keep on telling the same story over and over. But not when our institution really come up and do something deliberate. And that's what I want to say. Thank you.
There is a comment here on the chat by Professor Gabriel Adegoke. He said, I think he needs information on the issue of beer, with respect to its associated problems. So he said, making alcoholic drink beer a functional food. What are your comments?
My beer is non-alcoholic beer. It's not.
Okay.
Otherwise, my pastor will sanction me in church. The beer I'm producing is alcohol-free beer.
In fact, someone asked that if your beer is non-alcoholic, why are you calling it beer?
That's a common question, and it's rather unfortunate that that beer is not popular in Nigeria. If I go to Germany, there's zero beer. It's alcohol-free. It's possible to have a beer without alcohol. And so I have a mini brewery in my lab where we produce those things. It's possible. And I know it's very popular in Europe and now. So that it's part of so you can have a beer without alcohol. This is a common question, and I will just advise you to Google. You'll see several beautiful products online.
Great.
Though
Thank
their
you.
own may not be what we have only done, we have only made our own to be medicinal.
Good evening, Professor Oboh. I'm Marvelous Emmanuel. I'm presently a master's student in Balola University, and I was privileged to be your student as an undergraduate in the University of Medical Sciences. I am really inspired by this presentation you did, sir. And my question goes like this. Presently, I'm doing my research I'm studying doxorubicin as a drug, working on cancer, although it has a side effect. So I'm working on a plant called Piperginesi, which is this black pepper leaf plant, and seeing its side effects on renal toxicity that is being induced by doxorubicin. And just as you answered the previous question by a prof that raised the question about schools not having enough exposure on different offices that could convert research into production. As a student that is interested in functional food and how this my research can be converted into making products that making functional food that could help patients that are using this drug that are tackling cancer as a drug, using doxorubicin to tackle cancer as a drug, and then use this leaf to generate a functional food that can help to prevent the side effects of this drug. What are the things I can do, knowing that most institutions are not really leveraging on these conversion of research into translational research? As an upcoming student interested in functional food, what are the things I can do? What things can I use to grow myself up? Or what other exposure can I have that can help me convert my research into the market? Thank you, sir.
Thank you for the question. But one thing, the gap between vitro and in vivo is wide open. And there are some findings that you will have. Then the next thing you have to do is that product development. After the product development, will that product deliver the active ingredients? So there are a lot of things. Though it's a lot of lecture. Deliberately, I just went through it. But one is that I gave a case. Take, for instance, you have your antimicrobial, anti-cancer, nephroprotective, hepatoprotective. In what form will that thing get to the consumer or on the bedside? At the same time, we still retain its main activity. That was even a challenge on its own. Sometimes you may even do the thing at in vitro level. You do this, then you now develop the products. All that you administer, it didn't work. And so it's not there. Probably the way the thing is trapped, it's not easily released, or it's released in the wrong place. Doing the pharmacokinetics and all those stuff, there are a number of things you still do around it. So that is one aspect of it. Once we have taken care of it, that's why I said that most of those findings goes beyond the researcher just sitting there in his own laboratory. Take for instance, I know when I went to develop this lotion for foot ulcer, I had to bring in pharmacists, bring in some other people. Okay, this plant, I know it can work, but in what form can we do it so that at the end of the day, if we apply the lotion, it will work? The pharmacists came out with their own idea. The other, no, all the people that came out with the idea, we have to sit down and brainstorm before we can now sit down and say, okay, this is the appropriate material, this is the appropriate chemical, this is the appropriate thing we are going to use so that we can have maximum activity. So, though for a young guy like you, I think it's a good one. And I know you start research with curiosity. So I will not discourage you, but I know. But what I will advise after this usual normal whatever, you can probably chat me. We will talk further.
My question is partly answered from the last response of Prof, but nonetheless, I will still ask, for most of the patents that Prof got for those products, were clinical trials performed, or it's enough to stop at preclinical and animal studies since they are for human consumption? For patenting, do we, let me say, apply to myself as a researcher now, necessarily go to the extent of clinical trial before for patenting? Thank you, sir.
Obviously, like the beer, I did clinical trial. I did the human studies. Because that's the visual consumer. But though for functional food, it may not be, depending on the functional food, may not be as rigorous as a medicinal plant. You know, for functional food, some of those food you're already consuming them. The risk is not as high as going for entirely plant extract that traditionally they are not being consumed. Functional food, some of them are still even milder, except for designers' food. But most of my designers' food, I test them on human. I do some level of clinical trial, though I don't call it full clinical trial because of what it takes. I will call it clinical observatory study. That's what I use because of what it entails. But I can assure you, we have a good partnership with the teaching hospitals, and we have been. In fact, most of the time we work together. Like the HIV, we work together. We produce the team, after getting doing all the ethical requirements. They administer, we go, we monitor and other stuff. But you know, for comprehensive clinical trial is a lot of money, especially when it comes to community engagement, which I'm not sure the level of grants most of us carries in Nigeria can even go to that level. But especially those of us that are really working on medicinal plants. That's why I use the topic. If you can get a good fund, it should be necessary. Ordinarily, I will expect that the level of patent registration, they should ask that question. So for me, I know for majority of my products, we have partnership in the hospital that we work together.
Thank you very much, Professor Odetokun. So, we want to appreciate Professor Oboh for accepting our invitation. For anyone that knows Prof, he's a very busy person, busy with national and international research engagements. So on behalf of the AfriScience Network, we want to appreciate Prof for delivering the 43rd webinar of Science Network. We've gained a lot from your presentation, and as you said, discussion continues after the webinar. So on our platforms, so comments can still be sent. And we also want to appreciate everyone that participated in this webinar. As Professor Odetokun introduced, on behalf of the AfriScience Network, I want to appreciate every one of us for taking part in this webinar. And this brings us to the end of this webinar. Thank you very much, and God bless.
Thank you very much, sir. Thank you very much, Professor Oboh. Thank you very much, everybody.